Whether you've just been told you need a filling or already had one placed, there's a few things you should keep in mind when it comes to recovering from the procedure. Now, as I say filling, I am always brought back to the first day of dental school when the professor put up two images on the screen, one of a pie and one of a tooth, and he said, "This is a pie. Pie has filling. We don't do fillings. This is a tooth. Teeth get restorations." Second photos were of a toolbox and a dental tray. And he said toolboxes are full of tools and dental trays are full of instruments. So, fun facts for those of you out there who've just been dying to know exactly how we should be referring to these things. But the reality is everybody calls them fillings, so I'm going to call them fillings. I don't know if you know this, but teeth are almost always painless, even when they have cavities. I know it's crazy to think about it because we've all had toothache, so we assume it was caused by a cavity, and it makes sense. If you have a cavity, it should hurt. People go to the dentist when they have a cavity and their tooth hurts. But the reality is, dental pain, tooth pain, is usually caused by a cracked tooth or exposed dentin, the internal part of the tooth, that's not protected from the enamel. And sometimes cavities, but usually not, because it progresses at a rate that is slow enough that the nerve is able to adapt over time. Eventually, it can't adapt, and it dies slowly to the point where you don't even really feel a tooth pain. As is typical, I'm going off on a total tangent. Those will be in other videos. For now, what you need to know is that even if your tooth didn't have any symptoms prior to getting a filling, you should expect some after. The tooth is a living part of your body, unless, of course, it's already had a root canal. Let's assume it hasn't. If I were to perform knee surgery on you, first of all, it would be a bad day for both of us because I can't do that legally, but it would hurt if you weren't numb. Your teeth are the same way. Sometimes I think patients think about getting their tooth filled like getting their fingernails trimmed, but that isn't it. If we cut into your tooth and you're not numb and that tooth has a nerve in it, it's going to hurt like hell. So your tooth is a living part of your body, and anytime you have surgery anywhere else in your body, it's normal to have a few days or a couple weeks of soreness. The same goes with your tooth. But there's some different types of soreness, and some are normal and some are not. So after a filling, you should expect mild to moderate sensitivity to cold and chewing for a few days, sometimes a few weeks. Everybody's recovery time is different. But what you should not experience is severe pain, like drop you to your knees, like makes you catch your breath. You can't talk, you can't think about anything else when it happens, or spontaneous pain. Classically, it's wake you up at night, but it's also sitting watching your favorite TV show, all of a sudden it starts throbbing. You weren't eating, you weren't drinking anything cold, out of nowhere throbbing. Those are not good signs. It's important that if you experience severe or spontaneous pain that you give us a call, because likely the nerve is in the process of dying, and I don't know why I just said it that way. I think to emphasize the fact that it's not dead yet, but dying. And if that process begins, nothing we can do will bring it back. The tooth's going to need a root canal, which I know is a bummer, and I know it's lots of times over the course of my career I've had patients who try to ignore the obvious, and all they end up doing is suffering for an extended period of time, when the reality is root canals aren't that bad anymore, it's important for your overall health. So I don't want to go off on that tangent or rabbit hole either. This was supposed to be a video purely about post-op instructions for fillings. So yes, your tooth will likely be sensitive for a few days up to a few weeks. It should be mild to moderate. Drink a little cold water, get a zing, it's gone by the time you swallow it. If it starts lasting minutes or is severe, or you experience spontaneous pain, give us a call. Other things to expect: sometimes the filling itself can be a little challenging to floss, or a little easy to floss in the beginning. Those things change over time as your teeth kind of settle in. If at any point, it sometimes can occur that you start getting some food stuck between the teeth for the first few weeks. If that persists past a few weeks, make sure you let us know, because those teeth haven't settled tight enough, and we might have to add to that filling a little bit. Other things to keep in mind: if any of the soft tissue is numb, you should not be eating solid food, especially when it applies to the lower jaw, because not only is the tongue numb, but the lip is numb. And I used to think it was only, kids that we had to worry about chewing on their lip, but I took a buddy to lunch after placing a dental restoration in his tooth at one point, and about halfway through the bowl of chips, he had some blood dripping down his chin because he bit a hole in his lip. So it's just a hell of a lot easier if you wait until you're not numb. In the interim, you can have like protein shakes, Jamba Juice, something like that. The other thing to keep in mind is that if you can take ibuprofen, I recommend you take 600 or 800 milligrams. That's 3 or 4 over-the-counter ibuprofen, 3 times a day for a couple days. It keeps the swelling in the nerve down in the tooth, which helps decrease the tooth pain. It takes care of the swelling in your jaw joint, which takes care of jaw pain if you've been having to hold your mouth open. And it makes you feel a little bit better where you got poked with a needle to get numb. So overall, it improves your recovery so that you're even more excited to come back and see us next time and not dreading the experience because of any delayed soreness. As always, should you have any questions, don't hesitate to reach out to our office. My team and I are here to take care of you.